Yesterday with me in lab, right? It was fun. All right, we're gonna go into a little bit more depth with things today. Thank you. All right, respiratory. We need to be very familiar with this because the majority of the people that we are going to be taking care of are going to have some form of lung damage, okay? Mainly because this is the generation that grew up with ads that said, 4 out of 5 doctors prefer Camel cigarettes. Okay? I know that seems like, what? But those are actual ads from the 50s and 60s, before the Surgeon General came out saying, hey, this causes cancer. All right? So we all are familiar with how oxygen and carbon dioxide are exchanged within the lungs, correct? Okay, all right. And we're thinking going...
Swipe that?
Swipe.
Thank you.
The other way, that way.
Son of a biscuit eater.
Thank you.
Oh, for crying out loud. Oh, just takes a minute, okay. As with everything within the body, there is a lot to cover with respiratory, okay? Do they have, do they become short of breath when they run? Okay, how many of you guys go running and get short of breath? Okay. Is that normal for everybody to do that?
Yeah.
Should you be getting out more often and doing that?
Yeah.
Probably. Okay. Now, how many of you, now granted, you might have a hard time or get short of breath or anything, but how many of you guys actually have to stop and are like, I run up the stairs, I'm like, God damn. Okay. Yeah, I think I was the last one to finish the mile even in high school. They were like, we got 5 minutes to change, hurry up. I'm like, I'll be there in a minute. So, yeah, definitely never was a runner. We do need to make sure that we are inspecting and, of course, auscultating the front as well as the back of the chest wall, okay? We don't really think about it, but there's actually more oxygenating tissue along the back side of the lungs than the front, okay? Now let's hope this is gonna, maybe.
That'd be a little clicker.
It's, the battery died and it wasn't connecting, so. Is that the same? We just talked about that. Okay. One of the big things, especially with the elderly, is talking about health promotion. Now, not a whole lot that we can do at this point if they have COPD or what's called chronic obstructive pulmonary disorder, but we can help prevent, at a tertiary level at least, complications. So elderly people, just by being older, are going to be more prone to develop or contract pneumonia in their lungs because they're not taking as deep a breath. They're not getting the activity that they should be doing. Most of them are probably still smoking, okay? So we want to make sure that they're getting their pneumonia vaccines and hopefully a flu vaccine every year, okay? So what we need for our whole respiratory assessment, of course, your stethoscope, right? Although there's one student here who has a very nice one, and I'm very jealous. You're gonna need a watch. Why? Respiratory rate. We're gonna need a pulse ox. And then this funny looking thing. You know what this is? That is your patient's incentive spirometer. This will help prevent them from developing pneumonia in the hospital. It's not guaranteed to keep it from happening, but it will help prevent it. Okay? Typically, patients who are in the hospital, how often do you think they get up and out and move around when they're recovering after surgery or something like that? Not very much, okay? So if they're not inflating those lungs all the way that they should be, they can get pneumonia, all right? This little tool, which you guys, we will get to, I don't think I did it with you guys yesterday, did I? No. Maybe next week in lab, or, yeah, probably next week in lab. I'll let you guys work with this when we talk about, because I know there's another oxygenation lab coming up where we definitely talk about, or have you guys use that so you can get an idea of how it works. But it helps the person take a nice, slow, even, deep breath. And they're supposed to do it, how many times an hour? Anybody know?
12.
10. At least 10 times an hour. Okay? Now that doesn't mean do it all at once, because then if someone's having a hard time breathing, they're gonna get out of breath. I usually tell my patients there's about 10 commercial breaks within an hour of television. So if they just do 1 or 2 of those exercises within a commercial break, they'll get their 10 within that hour, okay? And typically it's while they're awake. We don't want them, obviously we're not gonna wake them up in the middle of the night. Hey, wake up, take some deep breaths. Not gonna work. Yes, Jesse?
So for like protective like precautions, when it says 12, like it says like 12 breaths or something per hour. Is that what you mean? Like, is that what it's?
No, that's that is 10 deep breaths, those exercises. So it's kind of like, how can I put this without sounding totally inappropriate? Pause that recording real quick. I don't want this on tape.